Doctor, just look at my donor. It looks whitish. Doctor, do you think I can do a second session? See? And sometimes we see patients, when we examine things, there is no donor. Everything has been taken away. This is called over harvesting. And to discuss this issue, I am Dr. Venkataram Mysore, dermatologist, hair transplantation surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Cunningham Road, Bangalore. What is over harvesting? Over harvesting means taking too much of hair from the donor area. What is too much? In FUE technique, in the first time that you do, you are supposed to take 1 out of 4 or preferably 1 out of 6 hairs, which means if you have about 12,000 units here, you should take between about 2,000 to 2,500 or 700. In some cases with a big head and a large density, you may be able to take up to 3,000. Generally, you should not take more than 1 in 4 hairs. Remaining hairs have to be left behind to camouflage this area. You can see here how one hole is covered by hairs in all directions. That gives us a good appearance. It also creates an opportunity for us to harvest more in the second session. What happens if you cross this 1 in 4 or 1 in 6? This is what happens. See this photo. It has become completely white. And now look at the next photo. Close up view. You can see that there are small white dots continuously. There is no hair surrounding it. That is because somebody has harvested 1 in 2 or even less than that. Why does this happen? Greed. Wanting to do too much. Hurry. Not bothering about ethics. That's why it happens. Patient asks, sir, I want 5,000 hair units. I don't want to touch beard or body. Take everything from here. In that case, our job is to tell them, look here. If you want 5,000, there are 3 ways you can do it. One method, you do 2 different methods, FUT and FUE. See this photo. In FUT, there is a strip as you can see here, but the area above and below is untouched where we can do FUE. This is one very good way of doing FUT and FUE to get more than 5,000 grams. Supposing patient doesn't want FUT or the doctor does not know how to do FUT. Remember, that is one thing which is very common. FUT is a difficult technique, difficult for the surgeon. Suturing needs skill and microscopic dissection needs a big skill. It needs lot more experience. Only doctors of my generation really learnt it because that was the only method at that time. Supposing patient doesn't want FUT, then what is the option? Take it from different areas. Something from the scalp up to 2,500, something from the beard 1,500, something from the chest 2,000, whatever. But for that you should have good hair on the chest and beard. Otherwise you cannot take. So 2 methods, 2 areas, and finally if good hair is not available, do a second session after this heals. 2 sessions with a gap of 2-3 months. Nothing is lost. It's not an emergency surgery. It's not cardiac surgery. For that, patient has to agree. More importantly, doctor has to counsel. Doctor has to tell, look here, this is the limit. You have a large bald area which is 2-3 times more than the donor area. We cannot put everything in one go. You come back for a second session. That is his duty to do it, to explain, to draw the line, to say the limitations. But instead, patient is ambitious and doctor says, let me put it, nothing is lost, he is giving my money anyway. Then what happens? Look at this photo. The whole scalp is full of holes. And then it looked like this, completely white. Look at this photo. This is not correct. Has serious problems. This area looks bad, healing is bad, infection can happen. So, moderation, adherence to basic scientific principles, very, very important. Once it has happened, what can be done? Doctor, what to do now? I don't have any hair to take. It is so ugly. Please do something. For this area, we can do scalp micropigmentation, meaning creating small little dots of tattoo so that it looks black as if it will look like hair, simulating a hair. That can be done. And for this area, if he has got a good beard and body, it can be used. Sometimes even pubic hair is used. And sometimes people ask us, take it from my arm, legs, etc. They are not good quality hair. But if that is not enough, then we have to try some new regenerative treatments, PRP, GFC, hair follicle growth factor, fat-derived growth factor, etc. But they are all very, very new treatments. And if nothing is possible, only a hair patch becomes an option. So, to summarize, it is very important for everybody to understand limitations of surgery. What can be done, what should not be done. Over harvesting should be avoided. If you need more hairs, choose any of these three methods. Two methods, two areas, or two separate sessions. Proper counseling explanation is necessary from the doctor. Doctor should put sense into the patient, said, I know you are ambitious, you want 5,000, but these are the ways to do it. And where it cannot be done, doctor should be honest in saying cannot be done. Otherwise, you end up in a situation like in the photographs that I showed you. You deplete the donor and the patient is very, very frustrated. That situation should not happen. Why it is happening these days is, one, as I said, is greed. Secondly, those who are implanting are technicians in many cases. They are performing independently, which is against the law. There is no experienced doctor to tell them, guide them. So in such cases, they don't understand, they want to just finish off the surgery. So they keep on extracting again and again and again, leading to disastrous situations. We keep seeing such situations every month. So, advice to the patients, be cautious, don't be over ambitious, have time on your side. And our earnest request to doctors, supervise the surgery, counsel the patient properly, and make sure that the patient has understood everything. I hope you have liked this video. If you have liked it, please share it. Please give more ideas for similar videos. Visit our website venkatcenter.com. Thank you very much.